Deep brain stimulation involves placing wires with special stimulating electrodes to specific areas within the brain. Electrical impulses are then delivered through these wires, which in turn help synchronize the abnormal electrical activity between various brain regions. Deep brain stimulation is highly effective at treating essential tremor, Parkinson's disease, and dystonia. In cases of essential tremor, it is able to significantly reduce a patient's symptoms and allow them to perform normal everyday activities such as eating, drinking, or writing. In patients with Parkinson's disease, deep brain stimulation is highly effective at reducing bradykinesia, rigidity, tremor, as well as medication side effect-induced dyskinesias. In cases of dystonia, electrical stimulation through DBS is capable of reducing unwanted repetitive movements, as well as relaxing muscles and reducing fixed posture that a patient may experience. It has been shown to be safe and highly effective for these three conditions. Deep brain stimulation is typically offered in instances where a patient's symptoms are becoming severe and impacting their quality of life, and when medications are no longer effective or when a patient is experiencing medication-related side effects. After the stimulating wires are implanted within the brain, they are then connected to extension wires that are run under the skin, down the neck, to the chest, and connected to a special battery that allows for electrical activity to be sent through the wires into the brain and to stimulate the intended structure. The settings on deep brain stimulation devices are highly customizable. Your physician may make changes to the amplitude of stimulation, the pulse width of stimulation, as well as the frequency of stimulation in order to adequately address your specific symptoms. Deep brain stimulation has classically been performed with patients awake during the surgery with their head fixated in a special frame. Patients are instructed not to take any of their medications on the day of surgery because typically special recording instruments are used to listen to cellular activity of the brain, which then helps guide where the final lead is placed. Patients may also be asked to participate in the surgery and asked if they are experiencing any abnormal sensations or any side effects related to motor function so that the lead can be adequately tested to ensure that it's located within the correct area. At Methodist, we specialize in a different technique whereby the patient is placed under general anesthesia for the entirety of the procedure. The procedure is done in a specialized operating room that contains an MRI scanner that is used to help guide the placement of the lead in the brain. A special targeting system is used to perform this procedure, which is highly accurate at placing the lead within its desired location in the brain. Patients are not required to participate in the surgery as they are under general anesthesia for its entirety. They are also instructed to take their medications the day of surgery. MRI sequences are obtained during the surgery, which ensures that the lead is adequately placed in the correct location within the brain, while also ensuring that there is no evidence of stroke or bleeding. Methodist Hospital is the only hospital in South Texas that offers MRI-guided asleep deep brain stimulation surgery.